Alors, on va commencer. Bonjour tout le monde. Hello, everyone. Merci d'être avec nous. We apologize for the delay. We obviously wanted to allow the state funeral for the Right Honorable John Turner to conclude. So thank you for your patience. I'm joined here today by my colleagues, Ministers Hajdu and Anand, and of course, Canada's Chief Public Health Officer, Dr. Tam, and the Deputy Chief Public Health Officer, Dr. Njoo. J'aimerais commencer en soulignant que l'application Alerte COVID est pleinement fonctionnelle au Québec depuis hier soir. Et pour ça, je remercie la collaboration de nos amis au gouvernement du Québec. Avec plus de 600 diagnostics de COVID-19 insérés dans l'application, ce sont des milliers de Canadiens qui ont reçu une notification d'exposition et qui ont su d'aller se faire tester et de s'isoler. J'encourage les Québécois et tous les Canadiens à télécharger l'application aujourd'hui. Aujourd'hui aussi, les ministres Anand et Hajdu annoncent que le gouvernement du Canada a signé une entente avec Abbott pour 20,5 millions de tests rapides de détection d'antigènes COVID-19 Panbio. Grâce à cette entente, les provinces pourront faire plus de tests plus rapidement. Les cas de COVID-19 pourront être décelés plus rapidement et tous ceux dont les résultats sont négatifs pourront retourner le plus rapidement au travail ou à l'école, par exemple. Encore une fois, merci de vous joindre à nous et je vais maintenant céder la parole à ma collègue Patty Hajdu, la ministre de la Santé. Patty?
Merci, Dominic, et bon après-midi. Dans un premier temps, j'aimerais dire merci au gouvernement du Québec pour avoir fait le choix de l'utiliser l'application Alerte COVID. J'encourage toutes les Québécoises et tous les Québécois à la télécharger. Nous sommes à 3,5 millions de téléchargements et il faut continuer à augmenter ces chiffres. So please download the COVID Alert app today, especially those in Quebec. I'm glad to share that Health Canada confirmed this morning that they have approved the first antigen rapid test, the Panbio test from Abbott. As Health Canada officials shared with you last week, antigen tests are expected to have a few advantages, including being easier to perform with limited training and being able to be done at the point of care with generally more rapid results. The Panbio test is quick and easy to use, and the results are available in about 20 minutes, sometimes even less. And antigen tests will be valuable tools for residents of remote or isolated communities or in special settings. They could also have a role to play in avoiding large cluster outbreaks when results are rapidly needed to avoid further spread of the virus. So before turning to my colleague, Minister Anand, who will share details of Canada's order for this test, I would like to remind Canadians to consider a virtual celebration this Thanksgiving. As everyone knows, it's been a challenging week, and virtual dinners, although less appealing, rather than an in-person gathering, can make a difference in reducing the spread of COVID. Saying no to friends and close ones is an act of love. So I will say to Canadians, I will join you in this, and it is a difficult time, I know, to be apart from family, but I think it's an important step that we limit our contacts. And with that, I'll turn over to Minister Anand.
Thank you, Patty. Good afternoon. As parts of our country confront rising COVID-19 infections and are faced with renewed restrictions, I strongly echo the advice of our public health officials. We have to double down to help slow the spread of the pandemic. This means having discussions with our families about social distancing, staying home, and wearing masks. Mon ministère, Services publics et Approvisionnement Canada, continue sans cesse à déployer des efforts visant à acheter de l'équipement de protection individuelle ainsi que d'autres fournitures médicales essentielles, des traitements et des candidats vaccins. Procurement of tests to detect COVID-19 has been and continues to be central to our fight to contain this virus. We know that cases are on the rise, making testing and tracing more important than ever. And the federal government is here to support the provinces and territories in this central effort. Plus tôt cette année, nous avons été en mesure de nous procurer 1,2 million de tests rapides de Cepheid et 100 dispositifs GenExpert d'intermédicaux aux fins d'utilisation dans les collectivités du Grand Nord. In addition, we have contracts with Biomérieux Canada for nearly 700,000 of their rapid tests. These and the contract for Abbott tests announced last week are just some examples of the federal government's efforts to supplement the current standardized testing regime. In terms of our announcement today, I, with my colleagues, are pleased to announce that we are adding to the lineup of rapid tests that we have procured. The Government of Canada has signed a new agreement with Abbott Diagnostics to purchase a total of up to 20.5 million antigen rapid COVID tests, which can be analyzed on-site without additional equipment, with results in about 20 minutes. This is in addition to up to 7.9 million ID Now rapid tests that Abbott will provide. In addition, the federal government has procured enough swabs, reagent, and other materials to conduct 200,000 tests per day in Canada for at least the remainder of the year. However, as we have seen throughout this country, challenges persist in scaling up laboratory capacity to process the increasing number of samples in the required time. Beyond providing rapid turnaround for results and much-needed capacity in northern and remote parts of our country, these point-of-care tests are crucial to expanding testing capacity more generally, because these samples can be analyzed on-site and do not require transportation to a lab to produce results. To be clear, the strategy in terms of our procurements is not to replace the standardized testing model, but to enhance the capacity of provinces and territories to keep up with the increasing demands for tests. Hence, our procurement strategy is one of diversification across various testing types and models. On behalf of the Public Health Agency of Canada, our work to procure a range of tests is ongoing, and we are on track to purchase additional types of rapid tests in the coming weeks and months. In closing, we are all living with pandemic fatigue, but please be assured our government is steadfast in its commitment to your health and your safety. Nous ne cesserons pas nos efforts visant à fournir de l'EPI de base à nos travailleurs de la santé de première ligne et à nos fournisseurs de services essentiels. Nous ne cesserons pas nos efforts visant à nous assurer que les Canadiens aient accès à un vaccin sûr et efficace, et nous ne cesserons pas nos efforts visant à procurer des tests de dépistage de la COVID-19 pour les Canadiens. Nous nous battons pour vous et à vos côtés pour que notre pays puisse se hisser de l'autre côté de cette pandémie. We are fighting for you and alongside you to make sure our country gets through this pandemic and emerges on the other side. Merci beaucoup, Megwetch. Thank you so much.
Thanks, Anita. Dr. Tam?
Good afternoon, good day. Bonjour à toutes et à tous. There have been 168,960 cases of COVID-19 in Canada, including 9,504 deaths. Over the past week, labs across Canada have tested an average of over 71,000 people daily, now with 2.5% testing positive. National daily case counts continue to increase, with an average of 1,951 new cases being reported daily during the most recent 7 days. At the same time, we are monitoring closely an upward trend in the number of individuals with COVID-19 requiring hospital care. Over the past week, there have been an average of 613 COVID-19 cases in hospital on any given day, and 16 deaths reported daily. Thanksgiving is a special time for many Canadians, a celebration centered on visiting and enjoying meals with families, friends, and neighbors. University students travel home, and faith groups gather in thanks. People often head indoors as temperatures drop and the weather becomes more unpredictable. We will be able to return to these cozy indoor gatherings one day, but while we live with COVID-19, we all need to think carefully about our Thanksgiving plans this year to protect ourselves, our loved ones, and communities. This is very hard because friends and families give us comfort. It might feel safer to gather with them, but this is in fact a false sense of security and can increase the risk of COVID-19 for those you love the most. There is a great illustration by New Zealand-based Susie Wiles and Toby Morris that I tweeted out this morning, and I'm hoping you are able to view this through media today. It shows us how quickly one case can become many in the absence of controls. It also shows us how the choices we make as individuals can have a big impact that will help to keep case numbers low. There are in-person activities we all need to do, and there are others we can live without. By limiting our number of close contacts, we can all help to slow the spread of COVID-19 and help essential services, businesses, and educational facilities remain open. Wherever you live, this year's cornucopia needs to include an abundance of personal protections and a set of virtual or safe distancing connections. Gathering indoors will be safest if they only include household members, especially where infection rates are highest. Gatherings outdoors that involve people from outside our households will be safest if well spaced. Remember, too close is too close, even if you are outdoors. Don't share food or objects. Bring your own is safer. Do share friendships, experiences, and the great Canadian outdoors, together apart. Just have to say that I may have to leave a little bit earlier, but Dr. Njoo is here to answer any questions if I'm not here. Thank you.
Bonjour à toutes et à tous. Il y a eu 168 960 cas de COVID-19 au Canada, dont 9 504 décès. Les laboratoires dans l'ensemble du Canada ont fait l'analyse des tests de dépistage de plus de 71 000 personnes par jour en moyenne au cours de la dernière semaine, dont 2,5 % ont reçu un résultat positif. Les chiffres quotidiens nationaux continuent d'augmenter. 1 951 nouveaux cas en moyenne ont été signalés quotidiennement au cours des 7 derniers jours. Par la même occasion, nous suivons de près la tendance à la hausse du nombre de personnes atteintes de la COVID-19 nécessitant des soins hospitaliers. Au cours de la dernière semaine, il y a eu en moyenne 613 cas de COVID-19 dans les hôpitaux et 16 décès signalés quotidiennement. L'Action de grâce est une fête importante pour de nombreux Canadiens. C'est une activité festive pendant laquelle ils visitent leurs familles, leurs amis et leurs voisins et avec qui ils partagent un repas. Les étudiants universitaires retournent à la maison et des groupes confessionnels se réunissent pour souligner leur gratitude. Les gens se réunissent souvent à l'intérieur, étant donné que la température se refroidit et que les conditions météorologiques deviennent plus imprévisibles. Nous pourrons recommencer ces rassemblements chaleureux à l'intérieur un jour, mais pendant que la COVID-19 sévit, nous devons tous cette année réfléchir soigneusement à nos projets pour l'Action de grâce afin de nous protéger et de protéger nos proches et nos collectivités. C'est très difficile car la présence de nos amis et de notre famille est réconfortante. Il pourrait sembler sécuritaire de se réunir avec eux. Toutefois, il s'agit d'un faux sentiment de sécurité qui peut augmenter le risque de contracter la COVID-19 pour ceux qui vous aimez le plus. Dr. Tam a affiché ce matin sur Twitter une excellente illustration de Susie Wiles et de Toby Morris de la Nouvelle-Zélande que j'espère que vous pourrez voir dans les médias aujourd'hui. Cette illustration montre comment rapidement un cas peut se multiplier en l'absence de mesures de contrôle. Elle nous montre également comment nos choix personnels peuvent avoir des répercussions considérables que nous aideront à limiter le nombre de cas. Il y a des activités en personne que nous devons tous exercer et il y en a d'autres dont nous pouvons nous passer. En limitant nos contacts étroits, nous pouvons tous aider à ralentir la propagation de la COVID-19 et faire en sorte que les services essentiels, les entreprises et les établissements d'enseignement demeurent ouverts. Peu importe où vous habitez, la multitude de célébrations de cette année doit inclure une abondance de mesures de protection personnelle et des arrangements pour établir des liens virtuels ou à une distance sécuritaire. Les rassemblements intérieurs seront sécuritaires s'ils comprennent seulement les mesures de ménage, les membres du ménage, en particulier dans les endroits où les taux d'infection sont les plus élevés. Les rassemblements à l'extérieur qui comprennent des personnes qui ne font pas partie de notre ménage seront plus sûrs si une bonne distance est maintenue. N'oubliez pas, trop près, c'est trop près, même si vous êtes à l'extérieur. Ne partagez pas d'aliments ou des objets. Il est plus sécuritaire d'apporter vos propres choses. Entretenez vos amitiés et partagez vos expériences et les grands espaces canadiens, ensemble à distance. Merci.
Merci beaucoup, Dr. Njoo. Dr. Tam, colleagues, so obviously we're happy to answer your questions.
Bonjour, nous allons commencer avec les questions au téléphone pour 3 questions avec une question de suivi chacun. We will start on the phones for 3 questions with 1 question follow-up each. Operator.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. The first question is from Mélanie Marquis-Lapresse. Please go ahead. Votre ligne est ouverte.
Merci. Bonjour. My question is for Minister Hajdu. I know you spoke about this yesterday during your press conference with Minister Lametti and Quattro, but I just want to go back to those private clinics who offer testing in exchange, of course, of money because it's private. On its face, it pretty much seems like a 2-tier system. So have you spoken to your counterparts in other provinces about this?
Merci pour la question, Mélanie. Et nous avons une équipe Santé Canada maintenant qui investigue la situation avec cette clinique. It's important that I have the full facts before I speak with the health ministers across the country in terms of what's happening. But in principle, of course, we will defend equal access to a public healthcare system because that is one of the principles that our healthcare system rests on. But I am having a team at Health Canada look into exactly what the nature of these concerns are and what the nature of these services are. And I'll have more to say when I understand the details better.
Great. So could you just give me a sense of how long this inquiry could take? And secondly, articulate what could be the sanctions that the provinces expose themselves to. And it would be, I don't know, pretty rich on the federal government's part to, I don't know, cut transfers when the provinces are asking essentially for $28 billion more in transfer because of the crisis.
Il y a des mécanismes pour Santé Canada d'appliquer les sanctions pour les contraventions de la loi de santé. It's important to note, though, that we need to have the details about what exactly is happening, and I'm expecting that I'll have those answers very shortly, so I can have a conversation with my colleagues across the country.
Prochaine question.
Merci. Thank you. The next question is from Dylan Robertson from Winnipeg Free Press. Please go ahead. Your line is now open.
Hi there. I have a question for the 3 ministers here because your offices and departments have been passing this one between the three. The Manitoba government says that back in the spring, it had ordered 2 million N95 masks from an American company, but U.S. Customs had intercepted it at the request of the Canadian government. I want to know if the province is being truthful here and how often the federal government has intervened to stop provincial orders of PPE.
Do you have that answer?
Anita, do you want to?
Sure. It's an interesting question. I will say that we have been working closely with the provinces to facilitate their orders. And throughout the pandemic, if, for example, a province had asked us to assist with its delivery of goods that it had independently ordered, we were very enthusiastic about ensuring that, for example, that we would assist them with the transportation needed. So I am somewhat surprised by the information that you are revealing. I will look into it, but I am going to tell you right up front that, on the contrary, our objective is to work with the provinces. I meet regularly with my provincial and territorial counterparts, ask them what they need, ask them how the federal government can be helpful, and put in place the mechanisms to get supplies, PPE, and the like to them as soon as possible. This happened with swabs in our northern communities, for example, and we will continue to facilitate and work with the provinces to get them what they need. Thank you.
Anita, Patty, do you want to add something?
No, I think that's fine. Thanks.
Yeah.
In terms of, you're asking me about in terms of the.
Well, there was some, Dylan had asked the question, I think there was some public confusion around whether we had redirected or something, some rapid testing that perhaps Manitoba or another province had ordered.
Yeah, so that was on the Abbott test, and there was some question, I think, by the Premier of Manitoba about why, in fact, Health Canada purchased all of the available allotment. We did that to make sure that A, we could get a good price for them, B, that we would be able to secure that amount of tests in a rapid way, and C, with the full understanding that they'll be deployed to provinces and territories according to the agreement right now that's being worked out, similar to one that we have for personal protective equipment. And finally, that those devices will be provided to the province free of charge. So I think the Premier can rest assured that those tests will be available to Manitoba in accordance with the agreement that we negotiate.
En suivi?
Sure. I was actually going to ask about the Abbott issue, but that is a separate issue from the N95 mask issue. But I'm wondering if Manitoba is getting what it deems to be enough of the tests from the bulk order, if they're able to order that separately.
In terms of the procurement of tests and other large-scale items, for example, PPE, early on in the pandemic, we worked out a system that works very well across the country, which is that the federal government, with its buying power and its procuring power, ensures that we get the full allotment that would be available to Canada. It also prevents some of the duplication of requests from provinces. And in fact, and I'm speaking a little out of turn here, but the Minister of Procurement can correct me if I'm wrong, it also facilitates smoother purchases on behalf of the company that is actually selling the device. What we have done at Health Canada through the Public Health Agency of Canada is work with provinces and territories to ensure that we have a distribution agreement that allows for a distribution based on per capita and holds back a certain percentage of the equipment, or in this case, tests, so that we can help supply additional equipment in the case of severe outbreaks or other kinds of requests for assistance from provinces and territories.
That's exactly right. And I will just add that our approach is to purchase in bulk the allotment that we are able to from companies like Abbott, so that then we can facilitate the distribution to the provinces and territories on the basis of the agreed upon formula that Patty is so usefully working with the provinces and territories on.
Thank you. Next question.
Thank you. Merci. La prochaine question est de Hélène Buzetti de Devoir. Votre ligne est ouverte. Please go ahead.
Yes, my question is for Dr. Tam. If she's still in the room, I can't see it on my screen.
Yeah, oui, il est ici.
Oui, merci. So, Dr. Tam, I wanted to ask you about the contact tracing app. I remember that at the beginning, when this idea was put forward, you were not super enthusiastic about it, and you were afraid of a false positive. And I'm just wondering, how afraid are you that this app could completely swarm the testing services that are already overloaded? We see in Quebec, in some cities, it takes up to 10 days to get a result, and we know that this app can sometimes tell you that if you've been in contact with someone because you happen to work just beside someone, but in fact there's a plexiglass separating both of you. So how concerned are you that this could create a problem rather than a solution?
Well, I think right now we're encouraging everyone to download the app and in order to facilitate contact tracing, and especially when you're looking at the number of cases increasing, and a lot of the times you can't actually figure out the contact tracing fast enough. So I think the app is there to add another layer of tool that people can use. So we're encouraging people to download it. But it is just an additional tool because you actually have to do something with that result. At the moment, I think the opposite is true in a way, in that we need more people who have the positive test to actually use that key that they're going to be provided and input it into the device so that their contacts can be alerted. So that's not, I think, happening sufficiently, and that people need to do that. When that happens, of course, public health does have to then figure out whether the contact is a high-risk contact or not, potentially. So that investigation still actually has to take place, and testing will have to be done. So, but I think especially in areas like Ontario and Quebec, where there's difficulties, linking those contacts, it's an important added tool.
You mentioned that you still have to detect if it's a high-risk contact or not, but how do you go about doing that with the app? Because the government went out of its way to tell us that this is anonymous. We don't actually know who's the person behind the positive testing. So if you get a notification on your app that you've been in contact, how can you assess whether or not it was a risky contact? Will not be the consequence that everyone receiving a notification will get a test, and therefore there will be even more people getting tests?
Yeah, I mean, only the public. You have to contact public health, basically, and that is an added workload on public health. If there's a lot of people going out to big, gatherings, that's not what we want. We want those contacts to be low. So if you get a notification, you're going to have to link up with your local public health unit, which is an extra piece of work. They will then have to figure out essentially whether there's any specific risk and whether you need to get tested. So I think, the app itself is not going to tell you whether you're a high-risk contact or not, whether there's a barrier or not. So those were the limitations that were previously identified by medical officers of health. And as I say, it's not a perfect tool. And I think that as the rates of contact and the cases are escalating, it is an important thing to do as an added layer of protection. Would it put more pressure on the testing system? Potentially. But this is where, I think the local public health human resource is the other aspect that needs to be supported as well, because they're going to have to determine if, certain high-risk settings have occurred.
We will now come to the floor for 3 questions with 1 follow-up question each. Nous allons passer au plancher. First question.
Mia Rabson from the Canadian Press. Dr. Tam, the President of the United States yesterday suggested we should not be afraid of COVID-19 and we should not let it dominate our life. I'm just wondering if you have any response to that assertion.
So I think we have learned a lot more about this virus over the last months. And so we do know what to do. And the difficulty is having everybody try and keep up with public health advice. So I absolutely agree that we need to take control of the situation. There are well tried and true public health measures that we know works. But with a sustained response, we need everybody to keep remembering what we just said. Reduce your contacts, wash your hands, put on a mask, respect the physical distancing. And it is a very complex and tricky sort of months ahead. But we should take heart in the fact that we know so much more. There's more knowledge on how people can treat someone with an infection. We're working hard on all sorts of countermeasures, if you like, vaccines and other treatments. And we are having more tests, as you've just heard, that there's many more tools. So we should not fear the virus, but we do have to adjust our lives in order to manage our way through it. So I would say, yeah, it's not fear that we are sort of looking at. I think the way to look at it is agency, is taking your own control over the virus and the risk that you can safely manage. And that, unfortunately, sometimes that's a very individualistic risk assessment, but we've been trying to take people through that thinking process as well.
And I'm not sure if this will be for Dr. Tam or maybe Minister Hajdu or Minister Anand, but you've mentioned we have enough swabs and reagent to do tests, 200,000 tests by the end of the year, but lab capacity is the problem. So what are we actually doing on lab capacity? Are there federal labs that we can add help with? Anything specific on the lab side would be great.
Well, thank you. And it's a complex question. I think we could probably follow up with a bit of detail, but of course, we do have some federal capacity to support in cases of surge through the National Microbiology Lab and another potential mobile labs that are also helped by the National Microbiology Lab and the Public Health Agency of Canada. We have a rapid response program that I think the Prime Minister spoke about a couple days ago, where we can pull together tools for communities that are in outbreak and that can provide additional assistance. But I think to your point, even more pointedly, is that we have a human resources challenge now in Canada. And in fact, what we're seeing around the world is that not only are we having a hard time keeping up with the pace in terms of the specialists and the healthcare workers that we need, but also the fatigue and exhaustion is a real challenge. We're hearing increasing reports of nurses, for example, on the front lines who are exhausted, public health workers, pharmacists, anybody that's a healthcare allied professional is reporting a higher degree of fatigue and exhaustion. And in fact, Minister LeBlanc will help us, I think, have a conversation in the next several weeks about the human resources challenge that is not unique to Canada, but certainly one that's being faced by countries all around the world.
Barry from CBC. I'd like to ask you about the reliability of the tests that you're announcing the purchase of today. I don't know how they compare to, say, the tests that are going to the labs right now. And I have heard that they said that even the company says that they cannot be used as the sole basis for treatment or other management decisions. So can you just talk about the reliability of them, where they fit into the, the testing regime?
I'll turn to the doctors first and then let them deal with the very precise medical questions.
Okay. So, like you say, there's lots of different tests which are now coming out. So the gold standard that we all know and everyone's familiar with is what we call the real-time PCR test. And that one is still the most important test to use, especially when you need to get the diagnosis right. For example, an ill person in the ICU or a symptomatic person in a long-term care facility. You have to get the diagnosis right. You need to do that test. The challenge up to now in some situations is that you need to actually collect the sample and send it to a laboratory. And so the new game changer is the one that was just introduced a little while ago, is the Abbott Rapid ID Now test. So that is also a PCR-based test. So that test, in terms of its attributes, sensitivity, and so on, is quite similar to the one that's sent to the lab, except it can be closer to what we call point of care and done sort of on site. And that one I think is very important, especially if we're planning to use it hopefully in the near future in remote and isolated settings. So that one I think is pretty straightforward. The new one that's going to be introduced, the antigen testing, we're also going to be putting out guidance very shortly in terms of how that best is used to its advantage in terms of an overall testing strategy. It is a given that this test is not, this type of technology is not as good as the PCR-based test, but it doesn't mean it doesn't have certain advantages. As the Minister Hajdu mentioned, it is easier to use in terms of just from a training perspective. A lot more people can sort of actually administer the test compared to needing more sort of a trained technologists and experts to use it. So that's one thing. You can also give a very rapid test results as well compared to the other rapid test, which is the PCR one. So this is where it gets a bit confusing. So how do we use the antigen test? Well, in general, the guidance which will be coming out shortly looks at it that for certain types of settings where you can maybe make up for the drop-off in sensitivity because you'll be testing asymptomatic individuals in certain settings on a more regular basis. For example, let's say workers in a remote a workplace site, or for example, in a very crowded facility like, let's say, a meatpacking facility. In those types of settings, because of the regularity of testing, antigen tests in general might have a useful place to be used in an overall testing strategy and save the PCR test for those where you actually have sick people in which you need to get the diagnosis right. There's lots of other possibilities too in certain outbreak settings where you need to at least start rapid public health action. You could be using the rapid antigen test to quickly identify those who might have been exposed and maybe are actually infected with the virus. But then probably you might need to do work on sending it for a more confirmatory test with the PCR. But at least with the presumptive positive, you can start undertaking public health actions. So there's lots more to unpack, but those are sort of the main points in terms of how antigen tests could be used as a complement to the existing PCR.
I can just briefly in French on that, and then I've got a couple of questions for that. A question for the
Français, oui. OK. Oui.
I'll just keep going, don't worry.
OK. En général, on a des nouveaux technologies pour dépister les personnes avec la COVID-19. La norme d'excellence, je ne dis pas en français, peut-être étalon d'or, c'est encore on dit le RT-PCR, Real-Time PCR. C'est vraiment pour diagnostiquer quelqu'un qui est symptomatique, peut-être dans les circonstances, si on a un patient dans une unité de soins intensifs ou peut-être une personne, un aîné dans un CHSLD. C'est important d'avoir les diagnostics très précis et fiables. Maintenant, avec l'introduction des autres technologies, on a aussi plus de choix, plus de possibilités. Le test rapide de Abbott ID Now, c'est aussi basé sur le PCR. Et on a aussi l'avantage d'avoir les résultats plus rapides et aussi, comme on dit, point au service. Donc, c'est très utile. Peut-être, j'espère bientôt, on peut utiliser un point de service PCR, un test comme ça pour peut-être les communautés isolées, peut-être au nord, pour avoir un résultat plus rapidement. Et ce n'est pas nécessaire avec peut-être le délai pour le transport des échantillons au laboratoire au sud. Mais maintenant, on a aussi une autre technologie, comme on dit, pour la détection d'antigènes. C'est sûr, le test rapide pour des antigènes, ça ne donne pas des résultats si fiables. La sensibilité est un peu diminuée comparée au PCR, mais c'est aussi des avantages qu'on peut utiliser pour prendre avantage des autres caractéristiques. C'est aussi un test rapide pour avoir les résultats. C'est aussi un point de service et aussi c'est très facile aussi, je pense que ça prend moins de formation pour quelqu'un pour appliquer, utiliser cette technologie. Mais je pense qu'on va, bientôt aussi disséminer des lignes directrices comment utiliser les tests d'antigènes. En général, je pense que dans les circonstances où c'est très important peut-être de tester d'une fréquence, peut-être toutes les semaines, peut-être les travailleurs dans les contextes plus isolés ou peut-être aussi dans une usine de transformation. c'est important de peut-être utiliser la technologie comme ça. Mais c'est sûr, si on reçoit un résultat positif, c'est toujours important aussi d'avoir un test de confirmation avec le PCR.
So, Minister Hajdu, do you see this taking pressure off the existing testing system? And I guess, Minister Anand, when do you think you're going to get these new tests online?
I think every tool that we add to the toolbox in terms of options for testing takes pressure off a testing system in general. So, as Dr. Njoo has pointed out, for example, you could see this being used in a setting where, in my region, for example, a mining camp, where it's hard to get to a clinic, where it's hard to access testing, but where there's a high degree of risk if there's an outbreak, including to the Indigenous communities around those work sites. So, for example, if someone is symptomatic, you can rapidly test them on site and then determine based on the clinical assessment if they need a further PCR test. But it gives that assurance in that setting that you are actually doing a more thorough screening than what might be possible right now. That for sure will alleviate in long term the situation in terms of all our health systems, because of course the more that we can prevent in terms of outbreaks, the better it is for everybody, and the less contact tracing that goes on. For example, all of the public health measures that have to happen after an outbreak like that as people move around from the site to their communities.
And on the contract specifics, which is what I deal with every day, let me just break down the contract for you. I announced 20.5 million tests. We purchased outright 8.5 million, and we have options for 12 million more. We are expecting those 8.5 million tests before the end of the year. But as we just received Health Canada approval yesterday, we are finalizing the delivery schedule. The purpose of the options is to allow us to have some flexibility in terms of understanding how well that test is working, what communities it's working in, before we make a decision to go and exercise those options. From a contracting perspective, that's optimal. Hope that answers your question.
Thank you.
Happy
Next
being
question.
in Global News. For Minister Hajdu and Dr. Njoo as well, I'm interested in the Toronto Star story this morning about pockets of Toronto with positive test rates above 10%. I'm wondering if when that happens, something so high, do you get notified at the federal level? And are you aware of other cases like that? And why is that number so dangerous?
Let Dr. Njoo start.
Okay, thank you very much for the question. So the first point about whether we get notified, yes, certainly we have very good communications. For example, Dr. Tam, myself, we're always in contact with our counterparts in the provinces and territories, the chief medical officers of health, as well as at the local level. So that would be Dr. Davila from the city of Toronto. So once there is, I think, a concerning situation, I think we have a nice tight community, I would say, in public health. And there's certainly all of our, I would say, our counterparts, our colleagues, certainly appreciate and know that they can call us anytime. So if there's something that we need to discuss from a public health perspective, what could or should be done, what could be done to support them from the federal perspective, well, we're certainly there for them. The 10% figure is something that's also been discussed at the international level, WHO and others, including ourselves here in Canada. Certainly when there's a, quote, a positivity rate in terms of the test done over 10%, that's very worrisome because that indicates there's probably a high degree of community transmission and lots of, quote, unlinked cases. And so that certainly means that public health authorities need to take whatever steps are necessary if they can identify high-risk events, certain settings that maybe need more intensive contact tracing. Those things are certainly things to be looked at. So I think the 10% is sort of I would say, quite a serious level. Even below that, we've been using the 5% level, saying that overall, it's good to keep sort of a positivity rate for lab tests below 5%. Once it's above 5%, it's something that you need to start looking carefully at what the local context and situation is. And certainly, as you're indicating, once it's over 10%, that's even more alarming.
I just concur with that, and it is an indication that more public health measures are needed, and that there is uncontained community spread. So it's very alarming because, of course, the report is around specific neighborhoods in Toronto, but we know that people don't just stay in their neighborhood. People move about and, of course, bring the virus with them. And so it's actually quite alarming.
And my next question is, I believe, for Minister Anand, but if anybody else wants to weigh in. The tests that have been approved, I know that on Health Canada's website, there are a handful of point-of-care tests being developed here in Canada that are still under review. I'm wondering if Canadian manufacturers, do those get fast-tracked to the top of your list? And is there any update on those cases like Nanotech?
We'll get back to you with an update on the specific progress of Canadian manufacturers, but I'll just say, no, we expedite reviews of tests that look like they have promise in terms of meeting the criteria that Health Canada has set out. Obviously, speed is of essence here in terms of getting product out into Canada and into communities. I will also say that our standard turnaround time is 40 days from the time of submission. And in fact, this Abbott test was under that 40 days. But in some cases, manufacturers don't have the clinical evidence that needs to be provided to Health Canada to complete the review. And so the request goes back to the company. In fact, regulators will work with companies frequently on trying to procure that information in a way that then they can assess to assure its integrity.
And if I could just follow up from a procurement standpoint, our approach has been, as you've seen in the last two announcements relating to rapid tests, to put in place contracts that are contingent upon Health Canada approval. And so we are engaged with a number of suppliers for rapid tests at the current time. And we are seeking to put those contracts in place so that if and when Health Canada approval occurs, we can quickly execute on those contracts and have the deliveries coming in quickly. Thank you.
And perhaps just to add a more general comment, we had a conversation, a number of us earlier today, about this very issue, the importance of building up domestic manufacturing capacity. We saw the importance around personal protective equipment, and our colleague Navdeep Bains worked with a number of industry players across the country to improve Canada's capacity. That, I think, has been a success on the personal protective equipment. But we also understand the legitimate expectation that Canadians would have that where there is an approval and a promising test, for example, we would obviously want to work with the Canadian industry to see how we can also improve domestic capacity while respecting, obviously, the regulatory approval process and rigor. But if you can do the two together, then it's value added for Canada in terms of having a domestic source also. So we're working on those levels right across industry in every corner of the country.
And Dom, if I could just step in here, I've been thinking about the importance of clarifying the federal-provincial framework in terms of deploying and distributing the rapid tests. And I want to make it clear that the federal government has not and will not be blocking any provincial orders. On the contrary, we will be facilitating the distribution of tests for provinces and facilitating their attempts to procure any items, PPE testing or the like.
And Anita, you also said, and including paying for it.
Yes,
Yeah,
we are here
which is
for the
not
provinces and territories.
which is not an inconsequential
But on the
authorization.
record, I think it's really important to reiterate that we have not and will not block any provincial orders on PPE or any other items, including tests.
Thank you. We will move to the phone for two questions and back on the floor afterwards. Nous allons aller au téléphone pour deux questions, puis nous reviendrons au plancher. Opérateur, prochaine question.
Thank you. Merci. La prochaine question est de Catherine Lévesque, La Presse canadienne. La parole est à vous. Please go ahead.
Oui, bonjour. Ma première question pour M. Leblanc, elle est en deux volets. Je veux juste revenir sur l'alerte COVID. Donc, il me reste l'Alberta et la Colombie-Britannique là, qui n'ont pas encore choisi d'utiliser l'application. Je me demandais où en sont vos discussions avec ces deux provinces-là et croyez-vous être capable de les convaincre, si oui, quand? Et en plus de ça, j'aimerais savoir, bon, il y a eu 900 alertes en 2 mois. Qu'est-ce que ça veut dire sur l'efficacité de l'application jusqu'à maintenant? Merci.
Alors, merci pour la question. En ce qui a trait aux discussions avec les provinces de l'Alberta et la Colombie-Britannique, les discussions se poursuivent. Évidemment, si on peut avoir une circonstance où on a 10 provinces et 3 territoires qui adoptent l'application Alerte COVID, c'est beaucoup mieux pour la santé publique de ces provinces-là et pour le pays en entier. Alors, moi, je suis confiant qu'on va finir, j'espère, assez rapidement avec une circonstance où on a toutes les provinces et territoires ensemble qui utilisent l'application Alerte COVID. Et qu'en ce qui a trait aux indications de contact possibles, comme la Dr Tam a expliqué, peut-être le Dr Njoo pourra ajouter, mais la Dr Tam, je pense, a bien expliqué il y a quelques moments l'importance pour les gens qui reçoivent une test positive d'ensuite utiliser l'application en insérant les chiffres ou le code approprié pour ensuite activer la notification, l'alerte comme telle. Alors, c'est un défi d'encourager les gens de télécharger l'application, mais ensuite, pour être conséquent, je pense que c'est aussi important que les gens qui reçoivent une test positive ensuite utilisent l'application précisément pour donner cette fonction alerte. Je ne sais pas si le Dr Njoo veut ajouter quelque chose ou...
Non, pas vraiment, mais seulement peut-être ajouter le point que je pense que c'est idéal, c'est tous les Canadiens, n'importe où au pays, peuvent utiliser la même application. Parce que même ici, dans la région capitale ici, nationale de Canada, Ottawa, je connais des amis qui habitent de l'autre côté de la frontière, au Québec et Gatineau. Et c'est sûr que les gens de Québec traversent le pont pour aller à Ottawa, peut-être qu'ils se sont exposés. Maintenant, c'est facile pour les gens de Gatineau aussi à Ottawa, si quelqu'un s'est exposé, d'avoir l'alerte sur le COVID, sur l'application Alerte COVID. C'est très utile et je pense qu'à un moment donné, on va avoir l'application pour tout le pays. Je pense aussi, pour ajouter le point de Dr Tam, c'est un outil, c'est une autre mesure supplémentaire, mais ça remplace par vraiment le vrai travail de traçage de contact. Et je pense que c'est très utile parce que si la santé publique à l'échelle locale a un cas confirmé et la personne dit « Ah oui, OK, moi, malheureusement, je suis allé dans un bar-restaurant avec beaucoup de monde. Je ne connais pas exactement avec qui j'ai eu un contact. » Avec l'application Alerte COVID, c'est possible que les autres personnes, s'ils ont reçu la notification, ils contactent la santé publique et la santé publique, les autorités posent la question, OK, où vous étiez? Et les personnes disent, ah oui, j'étais au bar, blablabla. Bla, bla. Et c'est le même bar que le cas confirmé. Ça aussi, ça aide tout le traçage pour les contacts. C'est un exemple pratique. Merci.
Oui, et ma question de suivi, en fait, c'est pour Madame Anand. En fait, sur la distribution des tests rapides, on sait, il y a le personnel de la santé, il y a beaucoup d'abstention actuellement, il manque des gens. Donc, à qui vont aller ces tests rapides-là en priorité? Et est-ce que ce sont les provinces qui vont décider des priorités ou vous pourriez là, imposer des conditions, par exemple, réserver ces tests rapides-là pour les communautés du Nord ou le personnel de la santé, par exemple?
Merci pour la question. Actuellement, ça, c'est une question pour la ministre Hajdu.
Négocier une entente avec les provinces et territoires pour distribuer des épistages, and we'll work out that agreement together as we did for the personal protective equipment agreement earlier.
Prochaine question en ligne.
Thank you. Merci. The next question is from Émilie Bergeron, Agence QMI. La parole est à vous. Please go ahead.
Hi, my question is for Minister Hajdu. You mentioned 3.5 million downloads for the COVID Alert app. Can we have an update on the numbers of keys that were inserted in the app to notify of a COVID case. So basically, how many people from these users were notified because they might be exposed to COVID-19?
Dr. Njoo has, I think, some precise statistics on that.
Yes, I do. What I can say, obviously, the numbers keep changing, but I think it's very encouraging. Obviously, we're getting close to about 3.5 million downloads. And at the present time, and this is probably from yesterday, 856 sort of a one-time keys were entered into the alert app. And as you can imagine, lots of contacts probably associated with those. And even from Quebec, Quebec only went live, barely hours ago, and already 15 one-time keys were entered in the first few hours once the application went live in Quebec. Vous voulez en français ou ça va?
Non, ça va. En fait, je suis pas sûre d'avoir compris combien de personnes ont été notifiées qu'elles auraient pu être exposées à la COVID-19. On comprend qu'il y a des clés à usage unique qui sont entrées, mais combien de personnes ont été rejointes avec ces notifications-là? C'était juste pour clarifier. Mais ma question de suivi, c'était pour revenir à une question qui a déjà été posée. À quel point c'est responsable pour quelqu'un qui a contracté la COVID-19 et un chef d'État de dire qu'il ne faut pas avoir peur de ce virus-là et qu'il ne faut pas le laisser contrôler nos vies? À quel point c'est responsable?
Peut-être je peux commencer pour la dernière question. On ne sait pas parce que c'est une bonne aspect de l'application Alerte COVID que comme dit, les données, c'est anonyme et on ne peut pas comme lier l'information personnelle. On garde vraiment la vie privée. Donc, on sait seulement pour les personnes qui ont mis le code parce qu'ils sont des cas confirmés. Mais pour le nombre de personnes qui peut-être se sont exposées, on n'a pas des chiffres pour ça. Pour moi aussi, je peux dire aussi comme Dr. Tam que je pense que le contexte est important. C'est sûr que tout le monde ici, même au Canada, partout dans le monde, il ne faut pas avoir peur de la COVID-19, mais il faut être, comme on dit, bien informé avec l'information. Il faut bien suivre, comme on dit, c'est quoi l'évidence scientifique et c'est quoi les consignes importantes. Et je pense que tout le monde ici peut répéter ces 2, 3, 4 choses importantes. Le port de masque, la distanciation physique, lavage des mains, restez à la maison si vous êtes malade, même avec des symptômes légers. C'est pas difficile. Et c'est pas seulement une question d'avoir l'information, mais c'est comment on utilise l'information. Ça, c'est la chose la plus importante. Merci.
Merci. Thank you. We will come back to the floor for 2 final questions.
Bonjour, c'est une question pour Mme Hajdu, mais si quelqu'un d'autre veut répondre aussi, ça m'irait. Quand on parlait des cliniques privées tout à l'heure qui demandent de l'argent pour avoir des tests rapides plus rapidement et qui font qu'on a un système de tests à 2 vitesses finalement. Vous avez dit qu'il était pour avoir une enquête. Quel genre d'enquête et quel genre de sanctions? Des amendes, fermeture de cliniques?
Ce n'est pas une investigation formelle dans ce moment. C'est une inquiétude, je pense, une investigation informelle avec les officiels de Santé Canada. Je dois comprendre la situation. Je dois comprendre la situation meilleure et après ça, je vais retourner ici et dire les étapes prochaines.
In English on the same question about the sanctions that could be found if
we have, obviously, this government has strongly protected the principles of the Canada Health Act, which is that it is universal and equitable and that there is, and obviously protected the idea that it should be about need, not ability to pay. And so if, I've asked Health Canada officials to determine what the nature of these clinics are, where they're operating and how they're operating. And then when I have that information, I will come back and let you know what the next steps are. The tools that we have in terms of managing these clinics are somewhat crude, but they do involve sanctions under healthcare transfers.
Ma deuxième question, c'est à propos de l'application COVID Alerte au Québec. Pendant plusieurs semaines ou plusieurs mois, le gouvernement du Québec disait « Ah, c'est pas super l'application. » Là, maintenant, ils embarquent, ils disent qu'il faut tout le monde la télécharger. Quel dommage vous croyez que ça a pu causer, un, pour la propagation de la pandémie, et deux, dans l'esprit des Québécois?
Peut-être, moi, je vais commencer. Le Dr. Njoo pour ajouter quelque chose. Je pense, dès le début, le premier ministre Trudeau a encouragé toutes les provinces et territoires de faire partie d'une seule application pan-canadienne. Il n'y a pas de doute, le Dr. Njoo l'a bien dit, le plus de Canadiens et de Canadiennes qui téléchargent l'application, que ce soit au Québec, que ce soit chez nous au Nouveau-Brunswick ou ailleurs au Canada, le mieux que ça va être. Ce n'est pas l'outil parfait, mais ça fait partie des outils nécessaires pour les autorités de santé publique de comprendre la propagation. Et pour les gens, comme le Dr. Njoo a bien dit, qui n'ont peut-être pas nécessairement eu un contact personnel ou identifié, mais d'ensuite recevoir une alerte qu'il ou elle était en contact potentiel et ensuite d'aller chercher des avis des autorités de santé publique régionales ou locales. On a compris les inquiétudes de toutes les provinces quant à la protection de la vie privée, des données personnelles. C'est pourquoi nous pensons que c'est une application qui rencontre les exigences très élevées, par exemple, de la commissaire à la vie privée. Dès le début, nous avons reconnu l'importance d'être sensibles à ça et nous sommes tout à fait enthousiastes de la participation du gouvernement du Québec et une meilleure façon de protéger les Québécois et les Québécoises dans le contexte. Je ne sais pas si Dr. Njoo a...
Non.
OK.
Pas vraiment.
My answer was so thorough that even the deputy public health officer couldn't add anything.
Final question, dernière question.
Hi, Mackenzie Gray from CTV News. My first question is for Ms. Hajdu and Dr. Njoo. I was looking at the slides that Dr. Tam put up earlier, and it said on them that we should watch the game at home and order takeout. But in hotspots here in Ontario, like Toronto and Ottawa, you're able to go to the bar. In particular tonight, the NHL draft's on tonight. There's going to be a lot of people who are going to go eat inside. They're going to watch some sports. They're going to drink some beer. And that is contrary to the advice that Dr. Tam is giving out and contrary to the advice that all of you are giving here. So for Ms. Hajdu, why is there such a disconnect between what the federal government is preaching and what Ontario is allowing? And for Dr. Njoo, you said earlier in the year that going inside to drink or have a beer or eat is something that you wouldn't do when the cases were much better. I asked you that question back then. The cases were much better back then, but surely now you must believe, Dr. Njoo, that bars and restaurants in hotspots should be closed if back in the summer when things were good, you wouldn't be willing to go in there yourself.
So I'll start, and I think that our advice has always been to reduce our contacts because as much as, we know that provinces and territories and local jurisdictions are working to try and get that balance right, of course, it's an individual decision, but the less contacts we have, the less risk we have of sharing the virus with others. Having said that, we also know that the disease activity is different in different parts of the country. Where I live in Northern Ontario, I think right now we have 1 or 2 active cases in the entire region of my riding, which is Northwestern Ontario, but the eastern part. But that can change in a moment. And we know that, the safest thing for people to do right now is to really limit their amount of contacts. Those decisions around whether or not a particular sector or a particular business or a particular industry needs to have restrictions placed on it are provincial and in some cases local, and we fully support those decisions at the federal level. But overall, our message has remained consistent and will remain consistent that your risk is reduced and the risk, therefore, to the people around you is reduced the less activity you undertake. And in fact, one of the surveillance tools that we monitor is mobility. How much are people moving around? to get a sense of how much more disease activity we might see. And in fact, we see that the more mobility there is, in fact, the more disease activity there is. So that's why we're reminding people on a regular basis to really reduce your contacts and really ask yourself whether or not this particular event is so important that you can't miss it, or whether you can say no out of an act of love.
Dr. Njoo, do you want to go in detail on your social calendar for the next 7 days, please?
Yes, I could do that. But no, I think just to add to what Minister Hajdu said, I think, first of all, in terms of, what officials say from governments, I would say that, of course, we can say certain things at the federal level, but Canada is a big country. And so certainly, we recognize our regional differences. So I would say at the end of the day, I would listen to your local public health officials. They're the ones who have to get sort of their finger on the pulse of what's actually going on in their jurisdiction. So here in the city of Ottawa, I listened to what Dr. Etche says, and she said, in terms of Thanksgiving, you should probably just keep it to your household, the actual people in your household. So I'm listening. I'll listen to her. The other point I think that's important to make is that it's a shared sort of responsibility in terms of both risk management and risk tolerance. And I would say, governments can do certain things in terms of regulations of what they do for certain sectors, be it bars, restaurants, and so on. But at the end of the day, it's all about individual behaviors. I think our Prime Minister even said a few days ago that, we're looking at the data right now, and it's concerning, but it's already been set. Up to the day before, the activities will determine what the data will be like probably for the next 2 weeks. So really, if you want to make a change 2 weeks from now, it's what we start doing today. So I think that's an important point to note as well. And then for me personally, I've certainly taken to heart the 3 C's in English, or on dit en français, vous évitez le bec, B-E-C. So in English, 3 C's, close contact, crowded places, close spaces. I could even add a 4th C in terms of continuous duration. So as you mentioned, all those 4 C's would apply in a sort of in a bar restaurant setting. If you're in a crowded place, closed space, maybe poor ventilation, and so on. I'm going to stay home and watch my sports in the comfort of my own home. And that's the same thing en français. Il faut éviter les étroits bondés, aussi les espaces, les contacts étroits, et aussi des espaces clos. Même principe.
Now, Ms. Hajdu, I understand, and Dr. Njoo, you mentioned this as well, that these are provincial jurisdiction issues. But you are the national government. You are the health minister for the entire country. Dr. Njoo, you're the deputy health minister for the entire country. And while there is a need to listen to local people, if we listen to Toronto, Dr. DeVille in Toronto says, close the restaurants. We need these closed now. There are too many cases coming from this, but the Premier will not grant that request. So are you saying, Ms. Hajdu, that as the national health minister, you will not intervene at any point in time, even if local officials are saying one thing and a Premier is saying another?
Well, I think the premise of your question implies that I would have a tool to intervene, and I don't. The federal government does not have authority over provincial governments in terms of those types of decisions. But I will say that we intervene all the time in the way that we work with provinces, territories, and local public health to make sure that they have what they need. So, for example, I've been in close contact with Dr. Davila and Mayor Tory over the last several weeks to ensure that we understand what they need to help contain their outbreak. I regularly communicate with Minister Elliott to get a sense of what she's proposing in terms of the next steps for the province of Ontario. And that's the way that I intervene as a health minister. And in fact, the work that I do, I believe, at the ground level with local public health offices and units is some of the most valuable work, because I get from the ground level a sense of what's going well and what's going wrong. And I must say that's helped inform my decisions and my advice to my colleagues around the COVID cabinet table and cabinet at large.
Merci, ceci met fin à notre conférence de presse. Thank you, everyone.